When you think about surgery, you probably picture all the drama, right? The intense focus, the high stakes action. But there's this other battle going on, a much quieter fight against an enemy you can't even see. So today, we're going to break down the 5 absolutely crucial and often invisible things surgeons do to keep every single patient safe from infection. Let's get into it. So let me ask you this. Inside that super controlled, sterile operating room, what's the one opponent that's always there, always a threat? Well, it's not something you can see on a monitor or a screen. It's infection, and specifically something called a surgical site infection, or SSI for short. And an SSI is pretty much what it sounds like. It's an infection that pops up right at the spot where the surgery happened. Honestly, this is the main adversary in that room. Preventing it is one of the absolute highest priorities for a surgeon. Every single step we're about to go through is designed to stop this thing in its tracks. So how do they do it? Well, the fight doesn't just start when the surgery begins. No, it starts way before that. It's all about preparing the battlefield, setting up those first and maybe most important lines of defense. Before we even talk about any fancy tools or high-tech gear, the number one weapon against infection is actually the surgeon's own skill. Yep, good, clean surgical technique, being precise, being efficient, and being gentle with the body's tissues, that's the foundation of everything. It just means less damage and fewer places for bacteria to get a foothold. It really shows you that prevention starts with pure skill. Okay, next up, disinfecting the skin. Now, you might recognize betadine, but surgeons often go with something else, chlorhexidine. And there's a huge reason why. It comes down to this thing called a residual effect. See, both of them kill germs right away. But chlorhexidine is special because it keeps on working, fighting off germs long after it's been applied. It's like leaving a shield behind that protects the patient throughout the whole operation. All right, so the patient's skin is prepped and shielded. Now the focus zooms out a little bit to the area right around the surgical site. The goal here is to basically build a protective bubble, a totally sterile zone to seal it off from the rest of the world. And the way they do this is surprisingly simple, but man, is it effective. They use sterile drapes. Now, these are not just some random pieces of cloth. They are specifically made to create a physical, impenetrable barrier. They basically wall off the entire area, making sure that absolutely nothing that isn't sterile gets anywhere near that wound. And when you look at the guidelines, they get super specific about this stuff. The source material actually calls this out directly, saying that plastic drapes are a no-go. It just goes to show you how every single detail, down to the material of the drapes, is carefully chosen to keep patients as safe as possible. Okay, so the main event of the surgery might be over, but the fight against infection? Oh, it's definitely not. The way a surgeon closes up and the care that happens right after, well, those have their own critical steps for a safe recovery. As the whole procedure starts to wrap up, 2 final things come into play. The first one deals with the wound itself, and the second one is all about the patient's body temperature. And believe me, both of them are absolutely vital to give the body its best shot at healing up with no problems. First off, if the wound needs a drain, it has to be a closed system. So why is that such a big deal? Well, think about it. Any fluid that pools up inside a wound is basically a perfect little home for bacteria to grow. A closed drain sucks all that fluid out safely, getting rid of that hazard and just tanking the risk of an infection developing later. Now, this second step, this one might actually surprise you. It's all about this number, 36 degrees Celsius. That's about 96.8 Fahrenheit. See, it's incredibly important to keep the patient's body at its normal temperature. They call it normothermia. When a patient gets cold, their immune system gets weaker and blood doesn't flow as well to the skin, and that makes them way more vulnerable to infection. So yeah, just keeping the patient warm is a surprisingly powerful way to prevent it. So we've gone from the prep, through the main event, and all the way to the finish line. Let's pull all of this together now and look at these 5 things, not just as a list, but as a whole system of care. And here they are, the 5 keys, all in one place. It all starts with the surgeon's pure skill and technique. Then you add that protective shield with the right disinfectant, chlorhexidine. You create a sterile bubble with the proper drapes. You make sure the wound stays clean with a closed drainage system. And you support the body's own defenses by keeping the patient warm. The thing to get here is that none of these is an island. They all work together, an overlapping system with one single goal, keeping the patient safe. These 5 practices are pretty much the gold standard for stopping infections in surgery today. We're talking about decades of research here, and they've saved so many lives. But in medicine, you know they're never going to stop learning and improving. So it makes you wonder, right? What's the next big breakthrough going to be? What will key number 6 look like?